Okay, so we are going to be getting into hormone health. So if any of you jumped ahead to get into this PowerPoint, you need to go back to the beginning and start over because most of hormone health is really a buildup of the principles that we've been working on so far. So our steps to hormone balance are as follows. You need to be able to eat fat and absorb fat. Okay, so that goes back to month one, where we're working on optimizing our digestive capacity. Okay. Insulin, which is our hormone that responds to blood sugar, always dysregulates estrogen, progesterone, testosterone ratios, and it slows down your thyroid. So you have to have a balanced blood sugar in order to have healthy hormones. Protein metabolism tends to drive thyroid health. T3 and T4 are protein hormones. T3 is activated in the liver, so you need optimal protein digestion and liver health in order to balance hormones from that direction, which again is what we worked on month one, month two. And absorbing fat requires bile health, which again goes back to our liver health chapter, right? So basically steps like 1 through 3 were in month 1 and month 2. We've worked a lot on stress control and balancing blood sugar in the previous months. We've talked a lot about sleep balance. A lot of your hormones are made as you sleep. Lack of sleep is a huge stressor that can cause hormone shifts. Creating used hormones from free versions via methylation is what we went through with a lot of you with genetics. And just supporting B vitamins. Methylation was a huge topic that we actually were balancing during month 2 in the liver component. Excretion goes back again to month 1, where we need to have proper bowel movements in order to balance hormones, because if you don't, you reabsorb them and can lead to excess. And then lastly, we have, our brain has to be healthy, and that's probably like the only one we've not really gotten to so far, but the brain is going to have its own PowerPoint after this. So a lot of the topics that we're going to talk about with hormone health are going to be refreshers or repeats of some of the things that we've already covered. And then we'll get into some nuances on, supplementation and maybe some other advanced strategies. But most of this is just going to be refreshing your brain on some of the topics that we've already covered. Like I said. So like I said, step 1 and 2 with eating and absorbing fat comes down to bile health and small intestine health. We've already gone through that ad nauseum, I think, at this point. Step 4 is where we're preventing the stress steal, which is what we went over in the adrenal lecture as far as the pregnenolone steal. If you forgot, when the body's under a lot of stress, it will actually take cholesterol and make cortisol, which is our stress hormone, instead of making estrogen and testosterone, which is what we want them to make when we're trying to balance our hormones. And that excess in cortisol can lead to feelings of weight loss resistance. It can lead to excess like stomach bloating, stomach fat, being just like overall puffy. A lot of these quote unquote like hormone symptoms that a lot of people experience. A lot of the reason that the first couple months we worked on balancing the blood sugar is because cortisol and insulin are inversely related. What that means is, insulin brings your blood sugar down, cortisol brings your blood sugar up. So if you're riding a severe blood sugar roller coaster all day, every day, these two hormones are both kind of getting exhausted and going into resistance. If you remember in one of the beginning lectures, we went over insulin resistance and what that means. Cortisol resistance is kind of like right there up with it, where both of them get exhausted by the chronic blood sugar swings and the ups and downs. So having like a more stable, like protein and fat-based metabolism that keeps these roller coaster spikes a little less severe are the key to keeping insulin and cortisol healthy and preventing that pregnenolone steal. Because there's number one and number two reasons for pregnenolone steal, which again is where our stress hormones are prioritized over our male and female hormones. Number one cause is going to be blood sugar instability. Number two is going to be lack of sleep, because your blood sugar balance is a lot more important to your brain than reproduction, because blood sugar is more of like a life or death situation as opposed to sex. So your body's always going to deal with life or death situations first before it deals with the other things. So we need to get it out of that life or death mode if we want to have healthy hormones. Yeah, so like I said, the second reason for the pregnenolone steal is lack of sleep. Sleep is probably the best hormone booster that there is. Even when you look at half of the hormone boosting supplements, like let's say testosterone boosting supplements, we have one here. It's called night tea. It's called night tea because it's supposed to boost your testosterone as you sleep, and the ingredients are designed to knock you out. Like the ingredients are magnesium, zinc, kava kava, melatonin, like those types of things, to just try to like knock you the heck out at night, because getting good deep sleep is the best hormone booster that there is, bar none. So we have to make sure that we are sleeping during optimal sleeping hours. Unfortunately, a lot of the like night shifts and just not going to sleep at a consistent time really tend to decrease hormone production. So we want to go to bed before midnight. We want to wake up with the sun. This is your kind of optimal circadian rhythm clock, if you will, where you're going to bed between, like let's say 9 and 10 at night. Melatonin is going to peak at midnight, putting you like in a deep restorative sleep. And then melatonin is going to slow down as we get towards the morning. And then cortisol is supposed to kind of take over around 8 a.m. and wake your butt up out of bed. Ideally, you're going to see sunlight at that time of the day, and that's going to encourage that cortisol spike early in the morning that you want. And then as cortisol is in your system from, like 8 till 3 in the afternoon, it's supposed to be the times that we are the most productive, that we're like the best at sports and all these things, because cortisol, while we knock it for being secreted in excess, is actually very necessary for optimal function during the day, for our energy and for our athleticism and for our immune system. It's very important. And then as we go into the evening, we're supposed to kind of slow down, stop so many stimulants, start dimming the lights, not having so much blue light from technology and everything, so that our melatonin can kick back in again. So following this circadian clock is what leads to optimal hormone health. It's going to really help with the brain, especially because the brain is what dictates timing and release of hormones. Like your ovaries or your testes, they secrete hormones based on when the brain tells them to, and when the brain tells them to is based on the circadian rhythm clock. Okay, so this is just another graph of what a normal circadian rhythm looks like. This is where we're going to have the melatonin, spiking around, midnight and keeping you asleep, where cortisol is going to spike around 8 a.m., which is the black graph. And then they threw in the core body temperature as well, because actually your body temperature is supposed to, drop during the night, just like cortisol is supposed to drop in the night to allow you to have better sleep. And then you're supposed to heat up kind of as cortisol comes up to wake you up in the morning. That's why optimal sleep temperature is, in the 60s. So yeah, so melatonin and cortisol are supposed to kind of always be in this opposites of each other kind of a graph. That's ideal, where melatonin is high at night, cortisol is high during the day. But unfortunately, due to blood sugar roller coasters, caffeine, not having a good sleep schedule, and just not seeing natural sunlight and having artificial lights all day, every day, really leads to this dance being flip-flopped, where we're having cortisol be high in the middle of the night, which leads to insomnia. And that is a huge reason for the pregnenolone steal, and a huge reason for any estrogen, progesterone, or testosterone crash, is a lot of times because of this inappropriate release of cortisol that is interrupting our sleep. But as I said before, most of what we've already done with our diet working on, burning fat and increasing our protein and, not having so many stimulants. A lot of things that we've done with the diet between like the gut and the liver cleanse have really been aimed at balancing this cortisol already. So as long as you've been following the principles from the first couple months, there shouldn't be anything dietarily that you really need to change at this point. Like I said, you might just have to look back and see if maybe you've fallen off the bandwagon on a few things and it's interfering with your sleep. Then, maybe you need to get your caffeine back under control, or maybe you've been having, too many snacks, or maybe you've fallen off the bandwagon with too many grains or something, and we need to reel that back in. But if you are following the principles from the first month where we're eating protein 3 times a day and, not overdoing it on caffeine and stimulants, then you should be able to keep cortisol under control dietarily. There's always going to be lifestyle things that, throw a curveball in this, where, if there's some kind of trauma in your life, then your body's going to secrete cortisol outside of the diet. But the diet is still, the number one cause of cortisol being dysregulated outside of crazy traumas. Okay. So after we, absorb the fat and get the hormones where they need to go and make sure that, cortisol is not stealing them, we have to be able to detox used hormones. Because if you do not detox used hormones, the brain is going to think you already have enough. It's going to be like, oh, we have plenty of estrogen, we don't need to make more. But the problem is that estrogen might be, the inactive kind, which is not what you need to have optimal hormone health. So we have to make sure that we are detoxing hormones in order for our body to call for kind of new, fresh ones, if you will. And methylation is one of the main things that allows this to happen. It happens in the liver, where this is going to go to like the COMT gene on your guys' genetic test, or the MTHFR, and then sometimes the MAOA. Those 3 genes kind of have the most to do with detoxing hormones. And a lot of them are dependent on B9, which is methylfolate, or B12, which is methylcobalamin. You just want that methyl word to be there. Or when we get to the genetics chapter, I have like a whole slide on different supplements that you can use for methylation, but it's usually going to be B9 or B12. A lot of these were covered in the liver detox supplements that you guys were all taking. The whole body cleanse and the detox packet are very, very heavy in a lot of these nutrients that are needed in order to help the liver to detox the hormones. This picture is estrogen as an example, because that tends to be the most dominant hormone that becomes a problem in our life, because estrogen is added so much to our food and our water and everything else that's a problem for males and females to be able to detox estrogen fast enough. So part 1 of estrogen detox is just like, don't overfill your body with excess estrogen in the first place, right? So going back to our liver chapter, where, decreasing exposure to plastics and makeups and scents and fragrances and all these things helps to just decrease our estrogenic load. But then the estrogen that we do have, we want to be methylated in order to be sent to the gallbladder, and then we want the gallbladder to be working with our bile in order to kind of shove those hormones out the poop, if you will. So we need all 3 of those systems to be working in order for that to go away. So these are all different reasons why that methylation of hormones is so important, and the liver detox of hormones is so important, is because it really plays a role in everything that's written in black here, right? So everything from like our energy formation to detoxing stress hormones to fertility and pregnancy, definitely huge ones for fertility and pregnancy, huge ones for DNA formation. So kind of going back to the fertility and pregnancy, you want to be able to build a baby without DNA errors, because a lot of DNA errors are what lead to mental developmental issues, right? So we want the DNA to be formed in a very precise way so that we're not having these, kind of DNA mistakes that lead to a lot of the common childhood developmental problems that we have. Methylation and estrogen detox are also going to have to do with mood, motivation, sleep, hormone stress, anti-cancer abilities, because excess of estrogen is a huge stimulator for a lot of different cancers. So, having this proper hormone detox is important for many, many different body systems, not just reproduction. Okay, so let's talk a little bit about the gallbladder and birth control and reasons that estrogen can be an issue. I apologize in advance, like most of this lecture is biased towards female health. I promise you we are going to have some slides on male health. But like I said, even males are having huge estrogen issues these days because it's added to so many of our foods, and it's just, in our water system. And then, having more of a sedentary lifestyle, or having excess stress, or having blood sugar instability actually does increase estrogen in males as well. So this estrogen metabolism stuff is just as important for you guys as it is for the females. But, our joke in functional medicine is when we go to these hormone seminars, my first hormone seminar was 4 days, and they said, okay, so the first 5 hours, we're going to cover male health, and then the next 3 days, we're going to talk about female health. And that's kind of just reality, that female hormones are a lot more fluctuating and a lot more complicated than balancing out male hormones. So I promise, just stick with me. We're going to get to the testosterone slides here shortly. Okay, so going into the gallbladder portion of the estrogen detox, like we said, it was like the phase 3 in the photo that we looked at earlier. An overwhelming amount of estrogen overwhelms the gallbladder. I've had a number of patients where birth control literally led to gallbladder attacks, and then getting off of hormonal birth control was the key to controlling gallbladder health in a lot of people. So if you have chronic gallbladder symptoms and you're taking, estrogen birth control, you might want to consider switching to like a non-hormonal birth control, so that it's not overstimulating your gallbladder and screwing up your digestion and messing up with your long-term ability to absorb fat and actually make your own hormones. So estrogenic birth control can be an issue for many, many reasons. But that's the top one, is that, our liver and our gallbladder and our detox systems get inhibited because estrogen causes such sluggish bile, and it makes us have a complete inability to flush things out. And honestly, a lot of people get gallstones. So don't want to do that. But besides birth control, excess sugar also increases estrogen. If you have a slow COMT gene, you might just be slow at digesting estrogen in the first place. So you really want to go back to, our liver lecture where we went over household products and beauty products that can be an issue for estrogen control. Yeah, like I said, the third point on here is improper excretion. We can have estrogen dominance in males or females, or we can have females that have testosterone dominance, which is what happens when we have PCOS. So anytime that your body is super inflamed, you can actually do something called ambitourization, where your body switches your male and female hormones inappropriately. So it can make women more masculine or males more feminine. And if we want to block that process from happening, then we really have to control our detox and, not be exposed to excess amounts of estrogen. So we need to go back to the liver slides and make sure that we have our things under control to prevent that from happening. Okay, so coming off birth control, which is something that, I highly recommend, just because I do feel like there's a lot of like long-term complications from hormonal birth control. I think I would prefer people have like an IUD if you absolutely have to have something, or if you do need to have, a pill, do a pill where you actually are still having a monthly cycle, instead of like the shot where you don't have a cycle for 3 months. I know that sounds like super fun, but it's worse for your hormone balance, because the reason you don't have a cycle for 3 months is because it's giving you such a heavy load of hormones in the shot. So it's way more likely to overthrow your gallbladder and your detox systems. Like I just had a teenager recently where she got the Depo shot, and It put her into a highly depressive episode for months because it takes 3 months for any of it to even really get out of your system, right? So getting birth control out of your body, if you're a fast COMT genetics, then you might detox birth control in 2 seconds and it's not a problem. If you have a slow COMT or a slow MAOA or a lot of MTHFR issues, you're probably going to be a slow detoxer of birth control and it'll take time to recover. Kind of like a good, like a fun quote for how long it takes is like 1 month for every year you were on it. Obviously it depends on the person. Everybody's different, but the point is you're not just going to recover from birth control in a week. It takes time because birth control eliminates a lot of your detox nutrients. It can deplete your B2, B6, B12, B9, all those very valuable for detox. Your magnesium, zinc, vitamin C, vitamin E, so it can deplete your immune system. Vitamin E, definitely necessary for heart health. Selenium, very useful for thyroid. There's a huge correlation between long-term birth control use and hypothyroidism, probably because it depletes your selenium and your B vitamins. So if you are on birth control, make sure that you have these nutrients covered because you're probably getting depleted from the use of that drug. If you have the flexibility and ability to switch to something else, I strongly recommend it. Just not to toot my own horn, I guess, but like I quit birth control when I was like 23 and I just used family planning from 23 to 35 when I finally had my first kid. So for the last 8 years being with my husband, we used the phone app that says you're fertile during these days and either you don't hook up during those days or you use a condom or other methods. And it can be just as effective as birth control as long as you and your partner are in communication and on the same page about when you need to be careful, and especially be careful if alcohol's involved, because that's, the one thing that really tends to screw people over with family planning is your inhibitions get screwballed with the booze and then things happen. But have your phone alert you when you're in a fertile zone so that you can, abstain during those days. And I'm a huge proponent of family planning. I really think it's something that can work as long as you and your partner are on the same page. I'm very blessed that my husband is okay with, checking the app or having the app on his phone so that he can see exactly when things are okay and when things are not okay or when we need to be more careful. But like I said, it worked for me from 23 to 35, and then I got pregnant within the first 2 weeks of not tracking it. So it can work. Obviously, it doesn't work for everyone, but it might be difficult if your periods are a little bit unstable, especially in the beginning of coming off of birth control. Maybe you're not having, every 4 weeks cycle, then it might be more confusing in the beginning. But, once you stabilize your cycle, I think it is very well over 95% efficacy on just using the app on your phone and doing family planning instead of having these hormones that deplete a lot of your other body systems. Right, so I already said most of these, but this is just another slide to give you guys examples of things that hormonal birth control can destroy in your body. Because I know most females, when they come into me and they want hormone balance, they either have a problem with stress like cortisol, thyroid hormone, estrogen, progesterone, or all four of these. So if you're on birth control and you want me to help you with balancing these four hormones, I'm going to tell you it's impossible unless we get off birth control. That's just the unfortunate reality because it is going to deplete all these things. We can give you these vitamins to help battle it as long as possible, but we're just not going to have optimal control of these hormones unless it's eliminated. Okay, so ways to balance estrogen dominance besides quitting the pill. Balance liver health, which we've done. Supporting gut and elimination, which we've done. Supporting stress response. That was the other hormone lecture we had this month. Sleep, we've talked about in excess. Reducing endocrine disruptors, we've talked about before. Fiber is one thing, just to like, as a reminder, you do need like 20 to 25 grams of fiber a day. Which can be difficult if you are having a lot of food allergies and a lot of reactions to different nutrients, but I do think that root vegetables is the easiest way to get this fiber requirement without like irritating your gut lining. But other things to check on is how much alcohol you're drinking and how much caffeine you're drinking, because overconsumption of alcohol and caffeine does lead to estrogen dominance as well. One of the reasons why alcohol leads to a lot of cancers is because it increases estrogen, and then estrogen increases your risk of cancer. Okay, so we're just not going to go in depth into the brain, but as an example, I wanted to give you guys a picture of, okay, so the brain is calling for cortisol to be produced. Cortisol is produced, then cortisol goes back to the brain, says, hey, we have enough cortisol, and then we stop. Unfortunately, this loop has a lot of places where we can have pitfalls, right? So we can have the brain stimulating the pituitary to make cortisol at inappropriate times because of our light dark cycle being incorrect. We can have inflammation blocking some of these pathways. We can have the blood-brain barrier be compromised from leaky gut, which is going to inhibit our ability to have this proper feedback loop of hormones. And a lot of times that is why we can end up with way too much or way too little of different hormones, is because this feedback loop can get broken, especially if you've had head injuries or concussions. Then this loop definitely gets interfered with, and we have to do a lot of brain balancing to get things back on track. But as I said before, most of this we've already been addressing through like the gut health and decreasing inflammation. So hopefully we've resolved most of this already. If not, then we definitely will during genetics. Okay, so our hormone system, let's just do like a little, like high school biology here. Our endocrine system consists of our brain, thymus, pancreas, adrenals, thyroid, ovaries, testes. We're going to be talking mostly about ovaries, testes, thyroid today because the adrenals had their own lecture. We've talked a lot about blood sugar balance and other lectures, and then the brain's going to have its own thing. Your thymus is your immune system, which we also were addressing when we were addressing gut health already. Okay, so how hormones work a lot of times. So the brain tells the pituitary tells everybody else what to do. Okay, so even when we do blood work, for example, a lot of times you'll see this like the TSH and the FSH and the LH are a lot of things that you'll find on like a hormone panel. And those are all actually brain hormones that are telling the organs what to do. A lot of times it's not the organ itself that is making the mistakes. It's actually some kind of mistake in communication, just because inflammation and lack of sleep really interfere with the communication of organs. So that's usually where the issue lies, as opposed to with the organ itself. So a lot of times with the thyroid gland, it's not the thyroid gland just decided to not work one day. It's because we abused it with improper signaling, saying, oh, I'm hungry. Oh, I'm not. Or I'm on starvation mode. Or I quit eating protein. Or I don't like animal meat. Or I don't eat enough fat. And then the thyroid gland starts freaking out because it's not actually getting what it needs. And it's trying to like keep up with our erratic diet habits, right? So a lot of times it's our erratic diet habits that cause the problem, not the thyroid gland in general. Or let's say maybe the thyroid gland got an infection and the infection destroyed it, but it's like, it's not the thyroid gland just one day decided not to work. That's just generally not how the endocrine system is. It's a lot smarter than that. So it's really our abuse of the endocrine system that tends to lead to a lot of hormone dysregulation, as opposed to the system just deciding one day that it's not going to work. So yeah, these are just same pictures of the same thing. But like I said, as a rule, glands don't malfunction. They're responding to the environment that they're put in. So we need to correct the stimulus and correct the surroundings more so than just hormone replacement, which is what is the stereotype. So the only time where, there truly is an issue with the gland is usually just in cancer. Because if the gland has cancer, then the gland can't do its job. But pretty much outside of cancer, glands can be recovered You know, I mean, you can grow back liver, you can grow back a lot of tissue in the body, like even if it's been 99% destroyed, a lot of times your body can grow it back just because have such a strong innate intelligence and your body knows that it cannot lose these organs. So yeah, like outside of there actually being, you know, a cancer level failure of the organ, most of the time you can bring things back. Okay, so with the pituitary. So like I said, the pituitary is what tells everybody else what to do. The pituitary tells your thyroid what to do, your male and female hormones, your immune system half the time. So it kind of dictates everybody else's stuff. So how do we keep the pituitary gland healthy? Number one is the sleep thing. Like I said, we need to keep our light dark cycles to be proper because lack of sleep is going to be like the number one thing that really screwy-Louie's the pituitary. We have to make sure that we have enough omega-3, vitamin C, B vitamins, polyphenols, which is like a plant antioxidant that you get from plants. So we have to make sure that we are fortifying these nutrients. So definitely if you have a huge genetic predisposition to being low on any of those on your genetics, make sure those are covered. And then just decreasing brain inflammation overall by treating leaky gut or taking curcumin turmeric based supplements can help as well. So these being like the top 8 things to do to help with the pituitary. Like I said, sleep, exercise, which we've talked about, adaptogens, which were in the adrenal chapter, things like probiotics, arginine and glycine are amino acids that you get from protein, healthy fats. So really just concentrating on a lot of the healthy diet principles and getting optimal sleep are the main things for keeping your pituitary healthy. I'm sorry if I'm boring you guys because this is a repeat of a lot of other things that we've gone through, but that's just the reality is your hormones respond to the environment that they're put in. So if we fix a lot of the environment, then a lot of times the hormones will come back. The only time the hormones don't tend to come back on their own is if they're literally bottom out at 0, which we're going to talk about. So I always get the question, like, why doesn't my doctor run my hormones? So there's a couple of reasons why your doctor won't run your hormones. Number one, hormones fluctuate extremely through the course of a month. Depending on if you get your hormones drawn on day 1 of your cycle or day 20 of your cycle, there's completely different expectations. And a lot of times doctors don't ask what day you had the testing done. So there's no flag for your hormone being high or low. You know, if estrogen can only be where between 30 and 400, you're going to feel a lot different at 30 than 400, I promise. But there's times of the month where 30 is normal, and then there's times of the month where 400 is normal. So it's kind of just a pain, and a lot of doctors are just not willing to deal with it. 2, hormone replacement is considered like a cosmetic thing. It's not considered medically necessary, so it's not covered by a lot of insurances. It's just almost considered like something celebrities do because they can afford it kind of a thing. So it's not always medically covered. And then there's only certain practitioners that will run like hormone replacement therapies because most of it is out of pocket. There's also not a great hormone replacement for brain-based issues yet, so that can be an issue. A lot of the hormone replacement doctors, even the ones that are pretty good at it around here, don't necessarily address the stress stealing aspect of things. So there's a lot of reasons why testing can get frustrating, and there's a lot of reasons why a lot of doctors just won't deal with it, but it's mostly because most doctors are in network with insurance, and if insurance says, hey, you can't run this test unless it's medically necessary, and then hormones are considered cosmetic and not medically necessary, it's actually pretty hard for a lot of doctors to do it unless they're willing to run outside of the insurance gambit. So basically just blame insurance for most things because they tend to dictate our medical system more than our doctors actually do, which is frustrating. So there's a few pros and cons to hormone replacement. and this is something that you have to just think about from an extremely personal basis. Like for example, if you have a slow COMT and you can't digest estrogen very quickly, maybe hormone replacement not a good thing for you because you might end up getting an estrogen overload way faster than other people and end up with like tumors, fibroids, or cancer, right? That's why a lot of people with the BRCA1 gene they don't get estrogen replacement therapies because it can lead to cancer, right? So if you have estrogen detox or estrogen related genes that are, at risk, then that would be a huge con that you don't want to do hormone replacement. Um, Hormone replacement can be expensive, especially if you're doing bioidentical and especially if you're paying out of pocket because it's not deemed medically necessary by your doctor. Um, a lot of the inserts that, I have patients that have, it's like $300-400 a month to get them. So, I mean, is it worth it for some people? Absolutely. But is that a huge expense? Yes. The pros to it would be, having adequate hormones does protect your heart, it protects your bone density, your muscle mass, your overall energy, vitality, and libido, which are the fun parts. Um, and hormone replacement therapies just have a potency that you can't get with supplements. I think with supplements, we can take you from like the lower end of a range to an upper end of a range. But if you're at zero, or like if you're completely bottomed out, sometimes you really do have to have the hormone replacement to bring you up out of the death zone, if you will. Okay, so here's my complicated picture of female hormones and what's normal on blood work. As you can see, it is divided into different phases of your cycle as far as before or after ovulation. It has different numbers for postmenopausal. It has different numbers for perimenopausal, and this is where things get tricky to define what is normal because there's such a huge fluctuation. But a general rule that I would stick by is you want to be in the upper third of the range to feel the best on most things. So as an example, so testosterone for females, the normal is 15 to 70. Most people, if they're at 15, they feel like they can't work out, they have no muscle recovery, they have no libido, like they have a lot of symptoms of low testosterone at 15. Whereas if you're, above 50, a lot of times you feel like rock star. So you really want to be in the upper ends of the range to feel great. If you're outside of these ranges, then you might be able to get things covered by insurance because then they can prove that it's medically necessary that you're low. But like I said, most people at 15, they're not going to feel good and they're going to want to get up closer to 70 to feel better. And that's a lot of times going to require a lot of supplements or hormone replacement therapy to get into that upper third of the range. And then secondly, for females especially, you do have something called an estrogen to progesterone ratio. And for some reason, I've never seen a lab test that actually calculates it for you. It's something that like me or your doctor would have to do manually. But you do want to make sure that that ratio is between 100 and 500 to make sure that you're not either estrogen or progesterone dominant, because that can definitely lead to hormone problem symptoms. Okay. So different like nutrient support supplement wise for different ages. So I like to separate things into like childbearing ages and non-childbearing ages. So if you are in like reproductive ages, your hormone balancing supplements are going to be on the left here. If not, you're going to be on the right. There's always a lot of overlap because you'll see things like the indole 3-carbinol, the DIM, the calcium diglucarate, the green tea. All those things are to help with preventing estrogen dominance. Okay, so that applies to all age groups. Methylfolate is going to apply to both age groups technically because that's just going to help with liver detox. Ashwagandha is going to apply to both age groups because it is adrenal adaptogen to help you deal with stress, right? So there's a lot of play between both of these where there are some that overlap, but black cohosh and wild yam tend to be biased towards the older groups because it helps with hot flashes and balancing estrogen withdrawal. Chaste tree tends to be more helpful for having like a normal cycle, so it might be better for younger age groups. But like I said, there's really huge overlap between these two. So this is just a few examples of, products that we carry that help with these. Anybody of childbearing ages should probably be on a prenatal, because the best time to take a prenatal is before you get pregnant. So if you're waiting till after you get pregnant to take a prenatal, it's technically too late, because the B vitamins in a prenatal are to help with proper DNA formation of the fetus. And after you're pregnant, like, that DNA formation is already kind of mostly occurred, and then you're just getting into replication, right? So like, you want to be taking a prenatal ideally before you get pregnant. Harmony is a great one just for balancing the female cycle. Same thing with the female health from Revive down here. Omegas are healthy fats that help us make hormones at any age group. Pregnenolone is that one, like I said, can be used to make estrogen, testosterone, cortisol, a lot of our adrenal hormones. So it can apply to both groups. Same thing with DHEA. The Ovex on here tends to help with heavy bleeding, especially in the perimenopause times when your bleeding tends to get out of control because of hormone withdrawals. Then the Ovex-P really helps. Turmeric just helps with inflammation because, like I said, if you're super inflamed, your hormones can switch back and forth between estrogen and testosterone inappropriately. So if we want to keep them where they're at, we want their inflammation to be down. Libido stim is what it sounds like. It's to help boost libido when hormones are low. And then the FemGuard is like a really awesome estrogen detox and just like overall hormone balance that has like your B vitamins already in it, as well as the chaste tree and the DIM and the DHEA. It's just like a good all-in-one product. Okay, so getting into male hormones. Sorry you guys had to wait so long to hear about the male hormones, but so for guys, we're gonna have either free testosterone or total testosterone. Like I said, you're gonna want to be in the upper third of the range to feel the best. A lot of times if people are in the lower third of this range, they feel like they have no testosterone at all. If you actually have no testosterone at all, you might want to consider hormone replacement, at least for a short amount of time, to kind of jumpstart your system. Because really, hormone balance takes 6 months to 2 years if you're doing it like with diet and nutrition and supplements. If you want it to take a shorter amount of time than 6 months to 2 years, then you might want to jumpstart your system with some hormone replacement. There are 5 things to help with male hormones. Like I said, a little bit simpler than females. But the 5 things that help with testosterone production are as follows. Sleep, which we talked about in excess. Steak is on here because you need amino acids and you need cholesterol to make hormones. So red meat is helpful. Squats, because any form of weight-bearing exercise is going to help increase growth hormone. It's going to help with muscle mass, and anything that helps with growth hormone and muscle mass is going to help with testosterone production. Sex, because if you don't use it, you lose it. And sun, because you need vitamin D and nitric oxide to have proper sex function. So, as I said, here it is. If you forget what nitric oxide is, you can go back to the heart health lecture, but it's what increases blood flow, and you need a proper blood flow to maintain an erection. So nitric oxide boosting supplements is like half of what's on the testosterone boosting shelf because it helps with erectile dysfunction. So reasons testosterone can crash can be age, overtraining at the gym, skipping meals like starvation mode. Like I have a lot of people that, they eat 1 meal a day, and it's really hard to get enough protein in 1 meal a day. I don't even think you can possibly digest the amount of protein you need as a dude, especially in 1 meal. You have to be extremely metabolically efficient to do that. Consider that a very advanced strategy. Low cholesterol can be an issue. So I've seen this from medications driving cholesterol too low, or guys with severe gallbladder sluggishness that are not absorbing their fat. We should usually know this because you will have extremely fatty poops and you'll go to the bathroom like nonstop if your gallbladder's freaking out that way. But you have to have a cholesterol above 150 to have healthy hormones. Yeah, chronic stress, like working or studying over 60 hours a week, can definitely bring it down. Insomnia, which we've talked about, and then yeah, the slow emasculization of societal norms would be the last one, but we're not going to put our tin hat on today. Okay, so T boosting supplements are as follows. So you have the left side are for the actual hormone support, whereas the right side is going to be more for below blood flow support for erections. So you'll see, if you're shopping for testosterone boosters, a lot of times it will be divided into two sections according to this. Okay, so going into thyroid. So your thyroid, it's best to think of your thyroid as your metabolism. So your metabolism is dependent on digesting fat and protein. Like we said, it's dependent on like having ample blood flow to increase your body temperature, all these things. So your thyroid gland helps with metabolism, it helps with heart health, it helps with development because it tells a lot of what your other hormones what to do. It is like a huge kind of like dictator of our male and female systems, if you will. So if your thyroid is compromised, it is difficult to have proper estrogen and testosterone as well. And it does play a huge role in balancing cholesterol. There are a lot of people that will have elevated cholesterol just because their thyroid is low, because you need thyroid hormone in order to have proper gallbladder detox. These are all symptoms of hypothyroidism. I think most people have heard of these, so we're not going to spend a lot of time on it. I just wanted to include it so that you guys could see it. So here's we have our hyper versus hypo. They're going to be opposites, right? Because if our metabolism is slow, everything else is going to slow down. Like our bowels are just going to slow down, our heart rate's going to slow down. We're going to be more tired, we're going to be more puffy. Whereas everything's moving too fast, usually we're going to like lose weight, be like long and thin, and we're going to have irregular cycles, a lot of sweating, anxiety, just because everything's turned up too much, right? So thyroid can turn things up, turn things down. Down is hypo, up is hyper. On blood work, what it's going to look like is as followed. I just included the blood work stuff on here for you guys. So I'll tell you it in person at your appointments, but if you forget, you can refer back to this PowerPoint to see which side you're on. So reasons that the thyroid slows or quits is going to be similar to why most of our other hormones slow or quit, but one is autoimmunity. Autoimmunity is a lot more tricky than others because it means that there actually is destruction of the tissue, similar to like with cancer, because our body actually starts attacking our own tissue inappropriately, and there can be a lot of inflammation and damage there. So I'll have a couple slides on autoimmune, but if you have autoimmune thyroid, a lot of times we need to address more than just your diet to make your body happy, because we really have to do a lot with the immune system, more so than just boosting your metabolism. But still, the metabolism parts are going to be important. So the not autoimmune type of thyroid, which is just like a regular slow functioning thyroid, is usually caused by crash dieting, not enough protein, aging, sleep deprivation, lack of exercise, decreased muscle mass, inadequate digestion of nutrients because of lack of enzymes or zinc, and then inadequate liver detox. So again, all things that we've addressed in other lectures. Just as a reminder, your metabolism is like building a fire, right? So carbs are the paper, fat is the logs, protein's the kindling. If we want to build our metabolism, it means we're building heat, which is equivalent to building our thyroid. So we need a hot fire to have our thyroid be burning and functioning at a higher rate, meaning we need the logs and the kindling and not just have an entire diet of paper. Yeah, proper liver function is required to make the active form of thyroid. So you have T4 and T3. Your thyroid gland makes the T4. Most T3 conversion is going to happen in the liver. So yeah, going back to liver health, making sure that any of your B vitamins that you're genetically predispositioned for are covered, because we need our liver to be on point to be able to make active thyroid. All right, so a little bit on like what is autoimmunity. This is just a good picture analogy, if you will, but it's this one on the lower right where your body is actually attacking you, which is not supposed to do. it's completely unknown exactly why this happens, but most of the leading philosophies are your body had a really bad infection where it got confused as to what was itself and what was the infection it was fighting. Um, there's a question as to maybe this has to do with having a lot of immunizations, because that does trigger a huge immune response that could maybe have the body be overstimulated into acting inappropriately, or just extreme leaky gut, which again is usually a form of an infection. So usually it's something dramatic, like people that usually had dramatic childhood infections or something that brought these things on, or huge hormone shifts, like some people will develop it like after pregnancy or menopause, because when we have huge hormone shifts, it also extremely depletes our immune system and maybe could make things act inappropriately. But like I said, a lot of these are conjecture. They're not 100%, like most people don't know exactly what started their autoimmune disease. So testing is a little bit different for autoimmunity, because like most thyroid testing is just T3, T4. When we're testing for autoimmune, we're going to test for TPO antibodies or TG antibodies. If those are above the normal range, then you have autoimmune. If you have autoimmune, you want to get either gluten or celiac testing done, because there's a huge correlation between autoimmune thyroid and having celiac disease. The treatment for autoimmunity is like hormone replacement is just step one, because a lot of people will be like, okay, well, I got my Synthroid, I'm good. But if you're autoimmune, there's so many other factors that are affecting your health besides just the depletion of that one hormone, because it's really your whole immune system that is on freak out mode. So a lot of times you do need, long-term anti-inflammatories like turmeric or resveratrol, or like long-term liver support, long-term food eliminations. There's just like a lot of other things that we do have to keep in check for autoimmune patients. I mean, we could do a whole lecture on autoimmunity, but I'll probably save that for one-on-one with you guys if I think that's a problem for you. A couple other funky patterns for thyroid that can often get missed on medical testing is the liver conversion time, because a lot of labs will only test for TSH and T4. They won't test T3. If we test for T3, sometimes we can identify if the liver is what's causing the thyroid problem. If you have low TSH and low T4, a lot of times it's that your pituitary is not working properly, and we need to actually work on balancing sleep and stress more so than anything else. So those are just a couple other patterns to keep in mind. Iodine is a huge area of debate, because too much iodine can be a problem and not enough iodine can be a problem. But the general rule is like iodine can make autoimmune problems actually worse, because it can stimulate tumor growth, and we don't want that. If you have the normal kind of slow thyroid, then iodine might be fine. But I mean, my personal philosophy is just to try to get what you need from food, so that you're not overdosing on man-made versions of iodine that might or may not cause problems. So here's just some examples of foods that you can get iodine from, just to get it naturally. And a lot of times if you get vitamins naturally, you don't have to worry about overdosing it as much as if you're taking it from a supplement. I never recommend iodine supplements. I'd much rather people just try to eat these foods. Yeah, so like I said, there's a huge connection between slow thyroid and gluten problems, especially if you have the autoimmune type. So definitely get gluten testing if you have the autoimmune type, or if it shows up on your genetics, you'll want to go get the actual test for celiac, because there's something called the autoimmune thyroid triad, whereas like if you have Hashimoto's, you usually are going to have celiac, and you're usually going to have problem with iron absorption and being anemic, usually because you have celiac and it's inhibiting your ability to absorb iron. So it is important to get that checked if you have those. So yeah, treatment options for thyroid. Obviously, hormone replacement can be necessary, especially if you're well below normal ranges. If you're close to the normal range, you might be able to get there with supplements like these two, because the Thyraxis PT or other glandular type things where it actually says there's thyroid gland in the supplement is going to be kind of similar to Nature Throid, So you can get a little bit of thyroid hormone out of some of these supplements, or you can take something like the ThyroCNB that helps with liver conversion to the active form. But lifestyle wise, we have the food eliminations, treat leaky gut, make sure you're eating the right amount of calories, which we can find on your body composition scan. Do weight training to make sure that you have adequate muscle mass, because if you don't have adequate muscle mass, that alone can slow your thyroid down. Low thyroid people do not do well usually with high intensity cardio, so you usually want to keep it in that fat burning heart rate that we talked about in the heart lecture. But you still do want to do some form of exercise to get the nitric oxide release and like the improvements in blood flow and heart health, right? You don't want to just avoid exercise overall. It's just that sometimes you have to avoid the stereotype exercise. Like you might not just be able to go, run 5Ks. You might just have to do, yoga or Pilates or like low intensity lifting or something in order to get your exercise if your thyroid's really struggling. Right, like I said. So yeah, so your prescription options are on the right here, or supplement options on the left. A lot of these are going to be things that, I talk about with you guys one-on-one. I don't like people just blindly going and grabbing things. So I hope that really helped you guys on hormone balance, and I hope it encouraged you to know that you've already been working on hormone balance the past few months. A lot of times the only thing that's missing is vitamin T, which is time, because hormones do take 6 months to 2 years to like fully bounce back and fully get into alignment. I know we all want the quick fix and we want to feel better like right now. If you need that, then I encourage you to investigate hormone replacement therapies. But if you're really trying to stick with doing things the natural way, you're just going to have to be resilient and know that it will come in time, but hormones just don't respond overnight. Like the gall or the stomach lining replaces itself every week or so. Hormones is not that way. It doesn't respond in a week. It's going to take time. Like you might notice as differences in your female cycle or your libido, or your get up and go might be better because your cortisol and stuff is getting improvements, but long term it's going to take 6 months to 2 years to fully get it under control. So hold on tight. I promise you can get there. You're just going to have to stick with it and be patient.